I'm Dr. Devon Ryan. I'm going to be joining SOS as an upper extremity surgeon. I grew up in a town called Bedford, Massachusetts, which is about 25 minutes outside of Boston. So I did my undergraduate at Princeton University and then ultimately did my medical school and residency in New York City at NYU. And then I did my hand and upper extremity fellowship training at Duke University in North Carolina. It's probably one of the only fellowships where you do like truly all tissue types. So it's, it's not just kind of one type of surgery applied in different locations. It's like all types of surgery, all types of tissue applied in a single region or single location. So you learn to do the nerve work, bony work, tendons, blood vessels, all of that. So I think that definitely plays into one of the interesting parts about it compared to some other options. My path into medicine was a little bit atypical. In undergrad, I was an economics major. I wasn't pre-med, so I thought for a time that I was going to be going more into the business side of things, and then ultimately decided that wasn't quite the fulfillment I was going to want in a long-term career, so came back around to medicine and ended up doing a post-baccalaureate program to do my pre-medical work, and then a research year, and I was always very interested in orthopedics once I knew that I wanted to go into medicine. Had a number of sports injuries growing up and a few broken bones, and sort of had an interest in the field from that perspective, and ended up doing a research year at NYU as well before medical school in orthopedics, and that really confirmed my interest in it, and I knew pretty early on in medical school that that's what I wanted to do. And then, once I started residency, the hand and upper extremity world really appealed to me from an early point, just because it's so varied and complex, and our hands are so critical to a lot of our function in our daily lives. So I think that variety in terms of the types of things that you work on within the upper extremity is what really drew me into the final field. So when I was going through the kind of job search process, I spoke to a few different groups, and especially in comparison to some other groups, I was definitely drawn to how collaborative the physicians were at SOS, both within the larger group and the hand division specifically. I think it was definitely something I wanted to be in a group of hand surgeons who, if they have questions about the best approach to a given patient, that they feel comfortable asking their colleagues what they would do in that scenario, and I definitely found that here. So I think from a work fit, that was definitely the place that I wanted to be. When I'm meeting for a patient for the first time, my goal is certainly just to get to know the patient, get to know their goals, hopefully earn that patient's trust, and then from there, based on what's going on with them, go about selecting the right course of treatment. And obviously, ultimately, given that I'm a surgeon, that may involve surgery, but for a lot of folks, what makes most sense for them isn't surgical. Maybe therapy, maybe immobilization for a fracture. And I think just developing that therapeutic relationship with the patient so that you can really identify what they're hoping to get out of the treatment plan is what's most important. So in terms of hand surgery, I definitely treat the full spectrum of patients from children, adolescents, up through adults. Our hand therapists are really critical to our treatment plans for many of our patients. Sometimes that can be in the non-operative management of a specific condition and getting them back to full function, and often in a post-surgical patient as well, restoring them to full function. So they really do play a critical role. And one of the great things about SOS is that we do have a team of therapists that we work closely with and can always ask questions of, and they give us updates on how our patients are doing. So all that's really important, I think, in the comprehensive care of our patients. So certainly one of the things we're most excited about with the new hand center is having all of our hand therapists, literally across the hall from us. I think it's always been great to have them close by, but to have them physically in the same location, it can be helpful to pull them into a room if we're with the patient, just to show them what we're thinking in terms of exercises they may benefit from, or if they have a question about a patient they're seeing on their side as well, they can come over and very easily ask us questions. So I think it only lead to more collaboration between the two groups. So, certainly I spend the bulk of my free time with my wife and our two kids, just doing any sorts of activities they may be involved with at a given time of year. So certainly get a lot of enjoyment out of that. And then otherwise, in terms of the more personal side, I spend a lot of time just like to stay active, running, lifting, exercise, any pickup basketball I can find. So that's what I spend the bulk of the time doing. a good portion of my family is local here. So my brother and his family has 4 kids, and then my parents are local now as well. So just getting to spend time with all of them, having my kids get to spend time with their cousins, that's what we're probably most looking forward to. And then I think we spent last year in North Carolina, which is certainly a much different climate. But my wife and I are both in the Northeast. We like having seasons and kind of getting excited for what each new time of year brings. So I think we're looking forward to getting more into that.